So glaucoma is an optic nerve disease. It usually affects the peripheral vision initially. It's generally not associated with any pain or headache or those type of symptoms, but the peripheral vision loss can eventually creep more centrally and at that point become much more evident. The type of peripheral vision change that patients have, oftentimes they don't notice, but we can detect on specialized testing. Most of the time, it's not an absolute blind spot in the vision, but it can present, for example, as poor nighttime vision or low light vision. It can present as taking a longer time to transition from walking, from a outside into a dim room or vice versa. Those light and dark transitions can be a little bit more difficult. Sometimes colors and contrast overall just kind of feels a little bit more muddied. In more severe forms, the vision can actually be much more dramatic and folks can actually lose the ability to read or to recognize faces or do other tasks. Sometimes folks can come in and already know that they have a family history of glaucoma, and that's especially important if it's in a first degree relative, such as a parent or a sibling or even sometimes an adult child. Other things that can sometimes flag